myself to the patient. Hello, Mr. Butts. My name is Shawn Anderson, and I'm your nurse today. I'm going to be doing your dressing change that the doctor ordered. Okay. I'm going to check the patient identifiers. This is Seymour Butts, medical record number 503-632-8282. And then I'm going to have pre-medicated him about 30 minutes prior to the dressing change. If it was IV medication, it would have been about 10 minutes before the dressing change. You guys learned that in farm.
Is that something you'll want us to say out loud when we're...
I'm going to see that you're thinking about pain. You can ask your patient. You can like really impress us and say, so Mr. Butts, I gave you your Vicodin 30 minutes ago. Can you tell me what your pain is on a scale from 1 to 10? And I'll go.
A plus.
Huh?
A plus.
A plus. Just stop there. You're impressing me already.
You don't have to do anything.
Okay, I'm going to raise my bed up to a workable height. You're fine. I just thought Mr. Butts was over there letting loose. See, that's why I can't be mean to you.
Did you say comments like that? Appropriate things.
It's dangerous. So, I'm going to put this to a workable height. I'm going to position my patient for comfort and so that I can do the dressing.
Just don't swear right now.
Yeah.
So I'm going to position the patient, roll to the side, so I'll be able to assess the wound. I'm also going to make sure that I am providing privacy for the patient. So our Mr. Butts is just half a man, okay? So we don't have legs, we don't have a head, but I would have a blanket over his shoulders and over his legs, only exposing the part of the body that I was going to be working on. I'd make sure my curtain was drawn for privacy, okay? For the purpose of the demonstration, so you all can see, I'm not going to have him on the pillow positioned, okay? So then I am going to take off my old dressing, and when I'm doing that with the tape, I'm pulling the tape towards the wound bed on all sides. I'm not going to pull it off this way and put pressure on that wound. When I take off the dressing, I'm assessing drainage, quality, and quantity, and I'm also looking to see what at every layer what I am taking off. Okay, I'm assessing it. Plus, I'm also realizing, well, if this is what I took out of the wound, I'm also thinking about what I'm going to be putting back in the wound too, right? So I'm going to pull out the packing. Okay, and I previously read the chart, so I know that he has 2 fistulas, and that I'm looking also for packing strips. So I can go into the wound bed and pull out the packing strips. Okay. And then I'll throw this all in the trash. Now this doesn't have to be biohazard because it has to be like dripping in bodily fluids. So this can just go into the regular trash. Okay. So this is my trash can, not my patient's bed. Okay. Then I'm going to do some wound assessments. Okay. And so in order to do the wound assessments, I'm going to have some sterile Q-tips. I'm going to do some measurements. Okay. And so I'm going to note that this wound is approximately 5.5 centimeters by 5 centimeters. I'm noticing that the wound bed is a beefy red. I do see some fat, and I do see some bone exposure of the coccyx. It's triangular shaped, and it's about 1 centimeter. Okay. I see that the height of the wound is about 1 centimeter. Okay, and now at this point I got a lot of numbers in my head, and you'll probably learn to memorize or hold on to, 5 to 6 numbers. So if I wanted to, I could take off one of my gloves, or both of my gloves, if I wanted to, write down those numbers, okay, get a new set of gloves on, and then I can use my second sterile Q-tip to reassess part of the wound. I'm going to be protruding the wound and looking for fistulas and the quality of the wound bed. And I know that the patient I see has some undermining that is pretty symmetrically even around the whole wound. About 1 centimeter of undermining. Okay, and then the patient's head is always 12 o'clock, and I know that he has a fistula at about 1 o'clock, and I'm going to measure that from the base of the wound. It's about 3 centimeters. So I inspect more, looking for, there might be some new fistulas. Sometimes the body makes new ones. He also has a fistula at 9 o'clock. That's about 2 centimeters deep. And so that's about my assessment of the wound. Okay? So I can get rid of my, Scott's in my trash bin. Take off my gloves. Wash my hands. And then I'm going to create my sterile field. Okay, Mr. Butts, I'm going to set up my sterile field right now, and I'll let you know when I'm going to get started. Okay. So when I set up my sterile field, first of all, I'm going to inspect my tray. I'm going to see what the expiration date is, make sure that if there's no holes. Then I'm going to open it. I'm going to remove the tray. And then some people use this as a trash can. Just wanted to. Okay. I'm going to position it so that the first opening of the drape is going to go away from me. Then I'm going to open each side. And then the final opening is going to come toward me. I'm going to remember that 1-inch border. I can manipulate my tray however I want, remembering that if things fall over, that 1-inch border starts at that area. So anything lower than the waist is not sterile. Okay. I'm going to go ahead and take out my sterile gloves for later. Huh? I think these are nice. That's okay. Yep. Then I'm going to open up my, so remember the video said you're not going to cross over your sterile field, right? So whenever I'm manipulating it, I'm always going around side to side. I'm not going to reach over and get any shedding into the sterile field. Okay? So I'm going to open up my irrigation tray, and I'm going to put it into my sterile field. So you're going to be dropping things into your sterile field. I want to make sure that nothing flops into my sterile field. So when we're dealing with a sterile field, we deal with like slow contained movements. Okay. So I'm just going to put that in there, making sure that this doesn't touch my sterile field. And that can be trash. Okay. I want to have my irrigation tray so that I can put my irrigation fluid in there. So I'm going to carefully reach in, keeping that sterile syringe sterile. And now my irrigation container is dirty on the outside, but it's still sterile on the inside. So now I'm going to add my irrigation fluid to that. And I'm going to pour that in there sterilely, not touching this contaminated thing, because what's inside of there is sterile, keeping the inside sterile as well. Okay. Now I know I'm going to use packing tape, So I'm going to open up my packing tape, and that needs to remain sterile too. So I'm going to put that in my field. And because I want going to later close this up and I want this to remain sterile, then I'm going to put that opening up instead of down where it will get contaminated. And so now I'm ready to put on my sterile gloves. And so I usually do this at the end of my tray. Okay. Now, once I have my sterile field open, I'm not going to turn my back on it. I'm not going to cross over. So if I had something over there that I needed to get, I can always keep my face towards the sterile field and move around it and get what I need if I needed something on the other side of the tray. But if I turn my back to it, it's not considered sterile anymore. So I have to start over. This Mr. Brooks. It's a water protected pad. Okay. And so I would put my sterile gloves on at the edge of my table, but for purposes of demonstration, I'm going to do it on the patient's bed so you can see. And I will be turning my back towards the sterile field, okay? But I want you to see the gloving. Okay? You never put your sterile gloves on your patient's bed and then glove. Okay, that's for the video. If I see this on YouTube, I know I'm breaking proper nursing care. So usually your gloves are always going to say, like there's a cuff end down, so you know which way to face it to open it. I'm going to open those gloves. And you're going to notice that they have a cuff. Okay, so I'm going to glove my dominant hand first. Okay. And I'm going to only hold the outside cuff so that so that the inside of my glove, this inside part is going to be contaminated, but the outside is going to stay sterile. So I only touch the inside part of the cuff. Okay. Now you don't need to like really mess around and pull this down all the way, because you're really only sterile from your wrist to your fingertips. And the more you mess around with things, the more likely you are going to accidentally contaminate yourself. Okay.
Do those gloves come in the package or not?
These ones don't. I just use mine up. So usually the ones that come into the package are about a size 7. They're a little bit bigger than this. My dominant hand that's sterile now, I'm going to put those fingers underneath the cuff, and that's going to protect them from my dirty hand when I go to glove. Okay. Now, when you're putting this on, so you want to get your fingers way under there, but you see this thumb here? He's a troublemaker because he's going to try and help you, but he's just going to get contaminated. He can't help you open things up and stay sterile. So once you get your cuff around your fingers, you're going to hear me say, hitchhike your thumb, get him out of the way. Okay? So he doesn't need to help you. Okay, once I get my gloves on, I can adjust them, make them feel however I want, and then this is where I live, in the sterile zone. Elbows in, hands not up, hands not down, only in front. Can't scratch myself back there just because I itch. Okay, so this is where I live. This is the sterile zone. So all of that just happened on the edge of my table. So now I'm sterile. So now I can play in my sterile field. Okay, so I can organize things the way I want them. I like things squared off. It bugs me when they're diagonal. You can leave them diagonal. That's fine. It doesn't bug you. Okay, I'm going to take my irrigation syringe. I'm going to loosen them up because they kind of stick. Okay. Then I'm going to put, this is sterile water, saline in my sterile irrigation tray, putting my sterile syringe in it. I'm very careful not to touch the outside of that because then that would be breaking the sterile technique. Then I see I have a drape, I have another drape, I have another drape, I have 2 Growixes. This pack is growing. I have some forceps, Q-tips, scissors, some tape. I have some 4x4 gauze and ABB